Can you see the slide now?
Yes, sir. Yes, sir.
It is seen well.
Yes. You can go for a slideshow.
Yes, sir, very much.
A slideshow full screen.
Shall I put F5?
Yes, sir. F5. Correct.
Yes, sir. F5, sir.
Sir remembers.
No, but I did F5. It is not.
Sir,
Sir,
கீழே இருக்குல்ல sir. One band is
on
there.
75,
Side 1 of
75%.
36. Yeah, next to
By the side of
75%, one small.
left side of the 75%.
Sir, kீழே sir, look into your screen, right lower corner.
Here, this arrow.
Yeah, there only. Click. If you go to that one beaker like a thing is there, no? Some wine glass like is there. Yes, sir, there only, sir. No. Next to that. There is one square, next multiple squares, and then one square with a stem. That one.
Maybe I think I manage like this only. It is visible.
Yes, sir.
It is visible, no?
This slide is visible, sir, but next slides, if they are seeing with mobile, it will be very small. Otherwise, go to top, sir.
How
There
about
is one
this?
slideshow. On top, there is a slideshow. Animation slideshow. Home, insert, design, animation slideshow.
Yeah, slideshow.
Go from beginning. First one. From beginning. Leftmost corner. Just below the thing.
The beginning.
Yes. Click.
Okay.
Good.
I think
very good.
Okay. Good afternoon to everybody. My topic is to talk about research hypotheses, framing the aim and objectives. I think making a research question and research hypothesis is the most important part of research. Unless you put the proper question, you will not get the proper answer. What we were discussing earlier, whether what we have done is relevant or not, whether it is applicable or not, will be decided on the way you put your question and make a hypothesis. So our objective of this session will be explain how research proposals originate and how to make a research question, how to make a research hypothesis, and also how to frame aim and objective based on your research question and hypothesis. So as it's said, necessity is the mother of all innovation and invention. So unless you have a necessity for it, you do not do the work. Let it be your graduation, promotion, or some day-to-day problem with your patient care or anything. So you find a necessity, then you work for it. Common man talks about other people, what they have done. He has gone here, he has come there, he has written, he has not published. So you talk about other people, you waste your time in discussing what others have done. Whereas an average man talks about the incident. He not only talks about, looks at the people, he tries to look at the problem, what has occurred. Whereas a great man looks at ideas. So he looks at how to solve the problem. So I hope that all those who are listening to this will become great men and develop great ideas for the future. So enthusiasm is father of excellence, said Johnson. Combination of necessity and enthusiasm leads to creativity. This is what the genesis of research proposals are. So once you have enthusiasm, once you have creativity, obviously you will get ideas and you will make a good research proposal. So how to get the idea? as Dean was telling, you might encounter a problem with COVID, H1N1, HIV, whatever is the problem, or in day-to-day your practice, you may find that the treatment available or the equipment available is not sufficient to care. So you have a problem. Once you have a problem, you should look for information about the topic. So gradually, already this some people might have found a solution to your problem. So whether such a solution exists or not, we can check. Then look for unanswered question. What they have found, what is not clear to you yet. So based on that, you can do the research. So you should have desire to acquire more knowledge, and more knowledge will lead to more questions. So pre-para clinical, clinical, if you keep fighting or if you do not coordinate and action it, we have discussed about coordinated research or multidisciplinary research. Unless you have cooperation and coordination, nothing is going to come out. Whereas if you make active relations, in the sense you mix with each other, you discuss the problem, you try to find a solution between para, preclinical and clinical relation related to our research, of course, yeah, outcome will be good. So always we should have good coordination, because individual department or individual specialty may not be able to do very serious research. For very serious research, you require cooperation not only from clinical, non-clinical, paraclinical, everybody should work together so the outcome will be good. So research, as Dean has said, it's a systematic and organized scientific process to find out answers to your question. So you have a question, you have a problem. So now you are trying to find out a solution to your problem. But whenever you have a problem, you may have a big problem, but you should also think whether you have facilities, whether you have resources, what are the limitations. These also you should think. Otherwise, you will jump into water without knowing the depth. You may drown in the water, you may not come out. So it is very important, not only you should have a research question, you should also look for facilities, resources, whether they are available or not. And it is always better to have a mentor in the beginning or the initial phase of your research. A good mentor will help you in taking you forwards. So what you do once the problem comes, you have an issue, so you have a research question in mind, then you have to do a systematic review of all scientific resources, both published and unpublished, in order to gain the information already available. Many times you may think you are getting a very new idea, but when you go to the net or when you go to the journals, and you will find that many of your questions might have been already solved. So it's important you should check the literature and see whether any problem is left in your question or it's already answered. So you identify a research problem and you do review of literature. It's important because you should not duplicate the work unnecessarily. As Dr. Satyamurthy has said, there is no harm in doing again research if it is not fully answered. But if it is well answered question, there is no point in repeatedly doing unless you doubt the findings of the research. The pitfalls and weakness in the previous studies you will know, and problems encountered by the previous person also you will be able to find out by doing the review of literature, because many of these publications will also say the limitation, the problems they faced, whether the sample size was important. The previous study will help you to find out the correct sample size required for your research. You cannot keep on doing study on human beings or animals more than what is required. So the ethical committee will ask you whether the sample size has been calculated, and they will permit you to use only enough number of animals or human beings, because it will cause unnecessary disturbance to others, including too many people or too many animals in your study. So you should have other to discuss about the issue. So where to search? One important source will be journals. Now thousands of journals are there. Most of the people will refer to the high impact journals with more citations because they think they are more reliable. It does not mean always so, because even in New England Journal of Medicine, Lancet, the initial COVID papers all they have to retract because without proper data they have published. When people asked for data, these people did not have data, so they had to retract their papers. So you may cut a sorry figure if not properly done. The study is not done. But one of the limitation of looking at the journal is that many of them may not be freely available. So your institution or some other institution will be subscribing for these journals. You should always take the help and go through the journals. You can also use other sources like now you have PubMed, Google Scholar, Embase, Scopus, InMed. So many indexing agencies are there. So they will, if you go through their website, they will tell you what all publications have been done in your area. So you carefully select your keywords so that you will get all those research what has been done by others. Of course, next we have a section on how to go through the literature survey. But the limitation of this journal publication and indexing agency that sometimes details may not be available, especially editorials, letters to editor, case report, research letter. There may not be enough editorial in that. Otherwise, usually editorial will give an idea what is inside. You can also look at textbooks. Textbooks, of course, often will give information which are little old because it has to go through many minds, many people, many research activities, then only it will come to textbooks. So many times the information in textbooks are little older when compared to the journal, but it will also give some historical data. It will also give some background information for your research. So the main limitation of textbooks is that information may not be very recent because it takes several years for publishing the data. So once you have a research question in the mind, you should think whether it is rational. Your question is rational, as I said, whether you have facility, whether you have manpower, whether you have money, all those things you have to look at it. And also you should see whether your idea is novel or you just repeating what others have done. There is no point in wasting your money and energy just repeating where it is already well established. So expected outcome and application also you should look at it. Am I going very fast or is it okay?
Okay, sir.
So
Okay.
based on this, you have to make a research question. The most important part in the research is putting a question. So if you put a good question, it is half answered. The question should be very relevant and very strong. So developing a research question is one of the challenging tasks for a researcher in initiating a project. The research question presents the idea that is to be examined in your study and is the foundation of the research study. It leads to the facts rather than opinion. So you establish not only the thinking, but also you put facts for the next generation to come. So all research project, the research question will give you the idea of your goal of your research, where you want to take your research to. So a good research question, you remember the word final, it should be feasible, it should be interesting, because if you take a topic which is not interesting to you, sometimes what will happen postgraduates, he doesn't know what topic the guide or the teacher says, okay, like that they will tell. So he will do something and bring. It may not be of his liking, so he may not take interest in doing it. So or even if you are doing your own research, It should be whatever you are investigating should be interesting to you, and it should be novel. It should be ethical, because no research should be unethically done. There is a research committee for humans, animals, all those, but still, sometimes you may bypass them or their way of thinking. And when you publish, there will be several questions how this study has been done. Finally, it should be relevant. If you do a research which is not relevant, everything is lost. So relevance is the most important. It should be feasible, it should be interesting, it should be novel, it should be ethically and sound, and it should be relevant. Now, I will give some example of research question based on my previous studies. Now, there is some evidence telling that zinc is useful in neonatal sepsis, because zinc is basically, now COVID also we are prescribing zinc. It is because the zinc helps in immunomodulation. It acts on the immune system. It improves our immune system. So we wanted to study whether zinc alters the inflammatory mediators in neonates with sepsis. We also wanted to study whether neonatal sepsis, the mortality can be reduced by zinc supplementation. We wanted to study whether erythromycin can reduce the gastric stasis due to vagotomy. So this is not, of course, a pediatric question. It is taken from surgery or medicine. So you may have an issue in your mind, then you put a question. So based on the question, you make a hypothesis. Hypothesis is a tentative conclusion or a guesswork which you are having in your mind. This may work, may not work. I thought, okay, zinc will work and reduce the mortality in neonatal sepsis, but it may not happen in real life, because what happens in the body is different than what you think. So you formulate a hypothesis. You base a hypothesis that zinc improves the outcome, reduces the mortality. So hypothesis basically a relationship between two or more variables that suggests an answer to your question. So you presume that it is likely to happen like that, or it is a declarative statement that predicts the expected outcome. It provides direction for collection of the sample, analysis, interpretation of data, or basically hypothesis tells you what, who, where, when, how, why, or it guides you to the research. Your aim and objective will be based on your research hypothesis. So you have a problem in your mind. You have to develop a research hypothesis. So the initial ideas will be there. You observe something, then you look at the literature to find out what has been done in this area. Then you make the problem statement, then operational constructs research hypothesis. So based on your idea, based on your research question, based on your analysis or review of literature, you make a research hypothesis. So research question is the basic. From there you go to the hypothesis. From there you will go to the aim and objectives. So a hypothesis should be verifiable and falsifiable. Many times you say call it as a null hypothesis. Suppose you think that a zinc reduces inflammatory mediators, you put the null hypothesis there. Zinc is not likely to reduce the inflammatory mediators. Then you calculate the sample size and reject the null hypothesis and say zinc is beneficial in treating neonatal sepsis. It is not a moral or ethical issue, the hypothesis, but it should neither be too simple or too general or too specific. It should be relative in between the general and specific, and it should predict the consequence of your research, and it should give valuable information. Whatever hypothesis you put at the end of your research, you should be able to prove or disprove. You should say yes or no. So at the end of your research, if you say, I want to do another study, then the basic question comes, why you have done this study? Because the sample size is too small. If your aims and objectives were not properly framed, you may not be able to conclude. So there will be no conclusion. Then at the end, you will start thinking, why I have done this study? And you write the limitation. I am not sure for what I have done this study. So it becomes an issue. So always it should be properly framed. The hypothesis can be very simple. In the simple like that, one dependent variable and one independent variable. You just think what is the connection between the two. Like here you have hemoglobin level, then you have infection in postpartum women. You want to know whether hemoglobin level will affect the risk of infection in postpartum mothers. So one group you have mothers who are in the postpartum period, other side you have the hemoglobin level. So you group them, hemoglobin high, low, middle, whatever grouping, and see how many had infection, how many did not have infection. Then you say whether there is any relation or not. Sometimes your hypothesis may be complex when you have more than one variables on either side, either two or more dependent or independent variables. You want to look at the relation, then it's called a complex hypothesis. Like satisfaction is higher among patients who are older and dwelling in rural areas. So one side you have patients who are older, who are coming from the rural area, than those who are younger and living in the urban dwelling area. So one is the rural area, one is urban area, one is young, one is old. So you want to look at these groups and see whether there is any difference in satisfaction, either regarding their lifestyle or medical care or whatever you want. So you have two variables on one side, another two variables on the other side, then there's a complex cycle. Normally, you put as in a research as a null hypothesis because you are putting in the opposite direction. So null hypothesis you have to reject, then you accept your thinking. So it is called null hypothesis. It provided a statement which is contrary to the hypothesis. It is a negative statement. There is no relation between two independent dependent variables. That is the null hypothesis. Now, smoking and coronary artery disease, you want to check whether there is any relation or not. But null hypothesis will be there, that you will say that there is no relationship between smoking and coronary artery disease. Well, after your investigation, you will find there is a significant relation between the smoking and coronary artery disease, and now you reject the null hypothesis and accept your thinking. So the other is called alternative hypothesis. Alternative hypothesis is given in a positive way. It states the existence of relation between two or more variables. Now here you may say smoking and lung cancer. So you want to check whether if you smoke too much, whether you will develop lung cancer or not. Of course, these issues are already there in public domain. I'm just showing examples. So alternate hypothesis will be positive, whereas null hypothesis will be always negative. So it may be simple hypothesis, it could be a complex hypothesis. Sometimes the hypothesis can be directional. You can also add direction to the hypothesis in the sense this way or that way. It's basically not only the existent, but also expected direction of the relation between the variables. The relationship could be either positive, negative, or you can say there is no relation between the two things. I don't think there is any relation. Then you do a research and you say whether it's really there is a relation or not. So now to give an example, there is a positive correlation between years of nursing experience and job satisfaction among nurses. So you want to see whether the nurses' satisfaction related to their years of experience or not. So you take nurses with different experiences and check whether how is their job satisfaction. You have to do a scoring system or some way of assessing the job satisfaction. Associate hypothesis occurs when there is a change in one variable, result change in the other variable. So you are here, you predict the relationship between the variables. And also you can say what is the relation which you are expecting basically hypothesis your way of thinking. So it may be correct, it may not be correct. So give an example. Communication skill among healthcare providers and cost of the care. So you are looking at two things. One is the communication skill of the healthcare workers, cost of treatment, whether it has got any relation to the satisfaction of the patient. So you can check healthcare providers' communication skill. You can check the cost of treatment in your hospital, and you can add both and check whether there is any relation or not. So once you make a research question, once you make a hypothesis, I hope all of you are with me till hypothesis. I hope that I am not confused. Only I was giving examples of hypothesis. Hypothesis basically is the way you want your research to go, the direction in which your research has to go. That is the hypothesis, or what you are anticipating out of your research is your hypothesis. Now we are coming to the aim and objectives. Aim and objectives should be more specific. They will overall nature and scope of the work. The term research aim usually refers to the main goal or overreaching purpose of the research object. So the main goal of your research is the aim. So in a research project, you will have one aim, but you may have multiple objectives. The aim will be one. So aims are usually broad and akin to the goal of the research work. A research aim will be followed by a series of statements which will describe objectives. It's clear? So aim is very broad. It gives a goal to your research, whereas objective is much more specific. It should be more clear. Indicate in more detail specific research topics. The objective should give the way more clear framings, and what you are going to investigate build on the main theme or the aim of your study. You make the objectives. There is nothing like how many objectives should be there in a study, but usually 250 objectives will be there. If you may have sometimes a primary objective or main objective on which you calculate the sample size, that will be called as primary objective. The others will be called secondary objectives. Or you may not have a primary and secondary objective. When you think that 2 or 3 points are very important, all of them will be objectives. So you can have a primary objective, you can have secondary objectives, or you can have a group of objectives depending upon what you are looking at in that research project. So if you have a primary objective, then the aim and primary objective should match with your title of the project. The project, the aim and objective all should match. So it is said that objective should be SMART, S-M-A-R-T. S for specific. So the objective should be very, very specific, because unless it is very specific, it cannot be measured. So it should be measurable. So whatever objectives you make, it should be measurable. There is some method in your methodology how to measure your whatever you want to check, and it should be achievable. The objective should be achievable within the time frame. You may have a very nice objective, but you don't have time, or it may not be feasible. So it should be achievable. It should be realistic, in the sense it should be within your available resources, manpower, and facilities. It should be able to achieve, and you should have time. So basically, remember, your objective should be SMART, specific, measurable, achievable, realist, and time frame. Now to give an example of aim and objective, now we'll go back to our zinc study. The aim will be to assess the effect of zinc supplementation on inflammatory markers and outcome in neonatal sepsis. So we wanted to look whether the inflammatory markers are altered, whether the mortality is reduced in neonatal sepsis by giving zinc to them. So objectives are, we have made another 3 objectives for the same aim. One is to assess the effect of zinc supplementation on serum called protectin, calprotectin. It's a pro-inflammatory mediator and some anti-inflammatory mediators. So in the infection, some pro-inflammatory, some anti-inflammatory mediators will be there. So we wanted to check whether zinc plus supplementation has got an effect. So this will also tell us whether it's by chance or scientifically there is some basis. We also to identify the association between the serum calprotectin and serum zinc level in neonatal sepsis. When the zinc level goes up, whether the calprotectin levels come down or other way around, what is happening. So that we want to check. Then third objective will be the effectiveness of zinc supplementation therapy in improving the outcome in neonatal sepsis. So these objectives are derived from the aim. So here you are looking at inflammatory markers, you are looking at the mortality or outcome. You can also put another one like a neurodevelopmental outcome of the neonates after 1 year, 2 years, whether there is any difference with zinc. Because zinc basically improves your immune status. It also has effect on the brain or neurological function. So that also you can check. So if you want to add more also you can add, but the more you add, your study will be longer. Like doctors, our director research will tell, if you want seed money, small, the objective will be 1 or. If you want extramural funding, you may put multiple objectives because they will give more money and you can spend more time. Now, I'll give another example. Perinatal asphyxia, the babies who are not crying after birth. Generally, earlier we used to treat them with the supportive care, anticonvulsant, and IV fluid, and sometimes antibiotics. But now therapeutic hypothermia has come, in the sense we therapeutically cool these babies to improve their outcome, both the mortality as well as morbidity. They are better neurological outcome. So in the initial phase, we wanted to study, we have done several studies on this topic. So we wanted to see whether you give therapeutic hypothermia, whether those babies do better than those babies who are not given therapeutic hypothermia, but your regular treatment. So the primary objective is to compare the reduction in the composite outcome of mortality and the neuronal outcome at 18 months. So not only you are looking at immediate mortality over 1.5 years, what happens to these babies? Not only their mortality, but also morbidity, in the sense whether their hearing is affected, whether their thinking is affected, whether their motor functions are affected. All this we assess. With the perinatal asphyxia treated with therapeutic hypothermia compared to standard care. So these are primary objects. So when you want to calculate the sample size, you have a previous study, then you can look at that, or you can presume. You say about there will be 10% improvement in the babies who are cooled compared to non-cooled. And based on that also you can calculate the sample size. The only thing is you may find sometimes if you presume the sample size is not sufficient to conclude at the end. Based on this primary objective, we have several secondary objectives to compare the outcome among term babies with perinatal asphyxia who received therapeutic hypothermia and standard care. So you wanted to look at the mortality at the discharge. You want to look at the neurological status at discharge. You want to look at their platelet count, whether it changes with cooling or not cooling, and necrotizing enterocolitis, which occurs in the small babies, and whether vasopressors, the incidence of hypotension is more. What happens to the mortality at 18 months, the neurodevelopment at 18 months, number of infants having visual or auditory dysfunction at 18 months. So several secondary objectives you may have. Each individually you can assess, or you can look at the composite outcome of all these together also you can do. So it all depends upon what you want to look at it. So you may have a primary objective, you may have a secondary objective. Now I have discussed with you how to get a research question. Based on your question, how to make a hypothesis. Based on your hypothesis, how to write the aims and objective, and what are the features you have to fulfill. Now I will give a short break for you so that you can work on a task. So all of you, I want you to write one research question, make a hypothesis, and write aim and objectives. It could be a study which has been already done, or you could have a new idea, whatever you want. So I will give you how much time? Shall I give about now 3:17? I suppose stop at 3:30. So what I can do is I will give you 8 minutes. Then I will ask you to present. Some of you can present your research question. Are you all ready?
Yes,
I
sir.
am sure that all of you are listening very seriously. Now I want to know
Yes, sir.
now whether the people have listened or not. I want to know. So just put a research hypothesis, aim and objective for any study. The study is yours, not mine. Baby is yours. Are you all ready? I think some might have already come with the research
Yes, sir.
hypothesis and aim and objectives. You already have? Ravi Kumar is smiling, so he must have already developed some. He is the coordinator. So you just think for 7-8 minutes, then few of you can tell me. Not everybody, if you cannot tell also is all right. But at least you give me some idea whether my talking was worth listening or not. At least I should know. Yeah. You can put any question. You write down research question, make a hypothesis, whether men better or women better. You make a hypothesis. Then you do a research. You tell me what are your aim and objectives. Because your methodology will be based on your aim and objectives and the research question. And you should be able to answer all your questions which you have raised after you complete the study. So when someone is ready, you can pass on the comment on the chat box or lift your hand or whatever you want. You can put on your video, whatever way. After lunch, sugar must be better, so the brain must be working much better. You can put it in the chat box also if you are ready, or you put on your video, or whatever way you want to express, you can express. Then we will give time to talk. We don't have too much time, but those who are not presented will make one research hypothesis, aim and objective, and send it to us. We'll check. All of you have to make. Only the difference is whether you want to make now or later. Anyone is ready? So you may be thinking, this fellow is asking questions also. We thought we'll only listen and go. No. Yeah, you can do from each discipline. You can do any discipline because we are only looking at the research question, hypothesis, aim and objectives. Anything, any department, any specialty, any topic, fine. Anyone is ready? I think the time is not much, but at least make a research question. If not the aim and objective, at least make one question and there are two things I can see. One is about women scientists are better than men scientists. One. Second one is on efficacy of prolonged speech and pause and talk treatment technique in school age children. Dr. Rakesh or so who wants to talk? Whether video feedback intervention through telemode is effective in developing speech and language in children with. Okay, we will take up this men and women scientists. Who has put this?
Me only, sir. I have put.
Is there any relation between vitamin D levels and glucose levels in diabetes? Dr. Manju, I think you want to talk?
Yes, sir. So that is my research, sir. I am.
Yeah. Yeah, what type of aim and objective?
Between vitamin D level. Yes, sir. Oh, okay, sir. That is my research
Yeah,
question.
vitamin D level and blood glucose level.
But there is diabetic people, sir.
Yeah, so
Hello?
what will be your research
Is it
hypothesis?
audible? My null hypothesis is there is no relationship between vitamin D levels and glucose levels in diabetic people, sir. The null hypothesis.
Okay, null.
The aim of the study is an hypothesis, and my aim of the study will be to study the relationship between the levels of vitamin D and glucose levels in diabetic people. For that, my objectives will be I'll be taking studying the vitamin D levels in diabetic people and normal people. So, my objectives will be first, second will be to compare the levels between the three groups, pre-diabetic, normal, and my second objective will be to study the possible if there is any relation association between level and
Yeah, in a short time you have done a very good.
levels and glucose levels. These
I
are my
think you
objectives.
can apply for next seed money project or extra mural grant because it will be an important study. Of course, there are studies on vitamin D and diabetes. So you can check vitamin D level in diabetic, non-diabetic, pre-diabetic, as
No,
you
sir,
said
this is all.
rightly, and then you see whether the severity matches that. Then for lesser, you give vitamin D and check whether they become better, the glucose level and become better. So that this you can make a long-term study. I think already some studies are there. You can look at whether long-term follow-up is there. Otherwise, you submit a
Yes, sir.
proposal. I think this will be a very good project. See, instantaneously the project
Yes,
has come up. So like this is what I want.
Sir,
All of you. Yes, you want to ask something? No, now you don't leave it there. You have to take a a conclusion, or you have to make a project, you have to submit, you have to get the money, then it shows the result. That's what we want. So all those who are listening, there are studies on hearing, there are studies on speech on children. So all these are good studies. So when you do a follow-up study and long-term study, there will be definitely funding because they have importance for the population. In the sense, we can improve the life of the individuals. So everybody is looking what is the outcome. So if you are going to improve the diabetic patient, if you can improve the hearing and speech of the children, they can become more useful to adults. So these type of things people will definitely like to have. So if you can show something scientifically, which can be helpful. So I hope that all of you listened carefully. I have got 2 more minutes. So you can ask any questions if you want. If I can answer, I will answer. Otherwise, your questions will be with me. I will, whenever I get answer, I will give you. If I cannot answer. Yes, Dr. Satyamurthy wants to ask. Yes. Yes, sir. You have to unmute yourself. Dr. Satyamurthy wants to ask something. You are muted, I think. Ravi Kumar, you can unmute him.
Sir, it is unmute. He can unmute himself, sir.
You have to unmute and talk. He says he's not getting unmuted.
Sir, what are the instances where we use research hypothesis or alternate hypothesis, and when do we use null hypothesis? Is there a difference?
See, research hypothesis is basically a null hypothesis. So normally you put null hypothesis because when you do statistics, you find the p-value less than so much. So you reject the null hypothesis and accept your research hypothesis. This is research hypothesis is positive or alternative hypothesis, whereas null hypothesis is negative. I don't know, people have put it like that initially, I think, because statistic calculation, the difference comes, then you reject it and accept your hypothesis. So it will be put in the reverse of your actual thinking. Yes. Yes, sir. I think your voice is not coming. You can type here, sir, otherwise in the chat box. His voice is not coming.
I have permitted attendees to unmute themselves.
Anybody else? Or you type, sir, in the chat box. Please make your research hypothesis, aim and objectives and send to us so that we will know that you have listened and also you have thought about it. And from this, you develop a research proposal which you should submit, either seed money or external funding. You can type.
Yes, sir. Now you are able to hear me? Yeah.
Yeah, we can hear you, sir.
No, I have a few questions. I have not really done the assignment, but I have a few questions just to kindle the minds of the people. I'm very happy that you are giving the assignment to the people. I always feel that brainstorming among different people, especially fortunately in a medical college, you have almost 20 departments are there. If people come together and discuss certain problem, the people, say for example, an oncologist thinks in a different way, a pediatrician thinks in a different way, and general medicine person slightly thinks in a different way because of their backgrounds. But they will throw some light. Maybe I will put some questions directly. So, for example, I'll take an engineering example to start with. So, for example, you know that when we are constructing a building, when we are putting the concrete, it takes about 6 to 8 weeks for curing. Technology has developed so much, but this curing time we are not able to reduce. why it cannot be done? Why certain materials can be added or concrete or any other material to reduce these things so that the construction period can be reduced? This is a problem which I will pose to the other people. I have one question to you because you are a senior, very experienced person. This is something haunting my mind most of the time is, for example, there is one couple, they have two children, one boy and one girl. They are brought up in the same environment, they are treated exactly same, but their mentalities are different by the time they attain the age of around 20. Is it the environment in which they are brought is exactly the same? In all probability, they might be going to the same school, meeting the same friends. In spite of all that, the environment, their priorities are different. Their outlook is different. Is it something to do with genes?
Yes, exactly. This question has been raised. Books have been written, articles have been published. See, people have looked into what your observation is very much correct. So the father and mother, see, the inheritance may not come only from father and mother. It comes from father and mother, of course. Grandfather, great grandfather, them also it can come. And so basically, you have a genetic basis in your body, which may get altered by the environment, which may be both the environment, like eating food or the environmental toxins, infection, so many things. That's called epigenetics. The environment changing the genetic representation. So one is the gene, the other is the gene, how it represents or manifests as a symptom. So they are different. So in the same environment also, based on your basic genetic making, it will produce different this thing. So two siblings need not be exactly same. They can be just opposite also. So one may be taking from father, another may be taking from mother or from grandfather. And environment also has got a lot of his friends, colleagues. They will also change the behavior a little. But mostly it is a genetic over which environment. So both are important. I think I have answered
A
your
nice
question.
book is there, sir.
Yeah.
Thomas Huxley, Nurture versus Nature. One nice book is there.
So many studies have been done in this. It's a very interesting topic. What you
Maybe
have raised.
fine. And of course, I wanted to hear your viewpoint because I did put this question to other people and got this genes idea and their priorities. Anyhow, another thing is, for example, if a person fractures his leg or hand, again, there's some curing time is there. You take say 3 weeks, 4 weeks, don't move. Whether that time can be reduced by giving any specific medication.
Yeah. If you are deficient in something like calcium, vitamin D, they can be supplemented. Otherwise, it depends upon the age. Like you take newborn.
That is fine. That is fine. No, at the age of a 20-year-old boy is shown. So,
Yeah.
for example, you are telling that you immobilize yourself for 3 weeks or some certain amount of period. Whether that period can be reduced by amount of some medication.
Yeah, if he is deficient, it will help. Otherwise, it may not help because the body, he may have diabetes, he may have some other disease which may affect the healing. So each person is different. In addition to
So like curing, this healing is also a natural process which takes certain amount of period which cannot be meddled with.
yeah, basic thing will not change. But if you have deficient of certain nutrients, certain things, it can be supplemented. There is one question here, whether hypothesis, research question, hypothesis should be mentioned in all projects. See, it may not be always mentioned, but many times it need to be mentioned because the person who reviews the proposal want to see what is the research question, what hypothesis you developed, the way you think he may look at it. But it's not necessary every time it has to be mentioned. Sometimes it may be implied, it need not have to be mentioned. It's not a must, but it is better in the sense the other person knows what you are looking for. I think you may have many questions, whatever questions you have, because I should not exceed my time and put the next person in difficulty. So whatever question you can pass on to Dr. Mahalakshmi or Dr. Ravikumar, we will answer again. And also your research hypothesis, aim, objectives and all that also you send to your link.
Though I'm taking 1 or 2 minutes, because you have mentioned that just when Dean was mentioning that this thing, I made a comment, I didn't elaborate it, that certain amount of repetition is not bad. I told certain amount. So, for example,
Sir, both of
100
you are
people
right.
should not.
Both
100
of
people
you are
should
right.
not take the. No. 100 people should not take the same problem and do it. Yes, that is wrong. But 2-3 groups of people can do the same thing and validate the thing. There is nothing wrong in that. That is one thing. And another thing is, at this age, I strongly feel, so for example, you are at one age group with 40 plus years of experience. A person who has just joined at the age of 25. You cannot ask him to start the work where you left, because he has to burn his hands through certain amount of repetition. Through repetition only is learning by the part. So certain small things, even if it is a repetition, for learning curve has to be there. Only thing is that learning curve has to be much faster than what we have taken.
When you
Clear.
teach them research methodology for PGs and UGs, we give very simple problems so that they learn the technique. But when they want to do PhD, we'll give much difficult system because they have to find the answer to a question. If they finish PhD and then they want to do research, then the person who is funding will look for much more serious thing. So repeating is okay for learning, but what Dean was telling from the Lancet study is that when you review the articles, more than 80% is waste. In the sense, they have just repeated what is already established, and the same results. If 1%, 10%, another person say 10.2%. How does it make a difference clinically? It does not make. So that's what I think the point is. See, no problem in repeating if it is not established or if it is not very clear, then definitely it should be done. For a beginner, it is okay to repeat because he has to learn the technique. But afterwards, the repeating is a waste. Suppose it's well established, there is no doubt in anybody's mind. But all this research and publication you have to take with a pinch of salt. My professor used to say, research is like a fashion. So long sleeve, so slow the middle, then they become sleeveless. After some time, they feel not comfortable with sleeveless. So again, it starts extending and they become full sleeve. No dadi, little dadi, round dadi, mattatale, like that each time the style will change. Research is also like that. So people keep changing. But he was a biochemistry professor. He used to say, PhD was given first student for taking tea in place of coffee. The people who are taken tea are doing better. Next student did another study. Coffee is better than tea. Then third student did study. Both coffee and tea you take as much as you take till no problem. That was the third PhD. So all of them have got PhD. All of them published papers. So what is the science behind that? So sometimes it happens because the data might have been not collected properly, analysis may not be proper. So all these things happen. So if there is a doubt, definitely it should be repeated. I think I have answered your question. So the scientific, I'll be talking about ethics in the last day. So these are some of the issues which I will be talking on why we should not waste our resources and why we should be honest in our findings. Otherwise, papers will not get retracted. When you ask for data, they don't have data. Some people will publish, but they will say, sorry, I don't have the data. Rat has eaten or there was a fire, something they may tell. So sometimes cooking up is done at a very high level, not only in the beginning level. Or I allow my student to do and publish, and I become responsible for whatever mistake he has done also. So it does happen sometimes. I think we'll go to the next, I think, because now it's 3:42.
So thank you, sir. Thank you very much for your extensive and elaborative session.